Uh, Bismillah ar-Rahman ar-Rahim. Today topic is the submandibular region. So we'll talk about the boundaries of the submandibular region and the structures are within this part of the neck. So firstly, when we talk about the submandibular region, we will know that the submandibular region lies in this area, where it's bounded superiorly by the mandible and inferiorly by the hide bone. So that's the mandible and that's the hide bone. This region will be the submandibular region. Firstly, let's talk about what is the hide bone. شنو هو الهايد bone. الهايد bone is an suspended bone in the neck, non-articulating bone, يعني bone ما يدرش فيه أي joints. Function بتاعه إنه هو is going to have attachment of some ligaments, some membranes and muscles attached to it. So it's giving an origin and insertion for a lot of muscles. So it's a U-shaped bone, okay, located in the neck, just superior to the larynx, and above the cartilage of the larynx, the cartilage بتاع larynx. So it's suspended from the neck by what's called the stylohyoid ligaments. So that's the hide bone, the body and the great corn and two small corns. يعني لو خدينا in details origin of some muscle بتقولها في greater corn أو في lesser corn. Okay, let us see what are the contents of the submandibular region. The submandibular region have muscles, ligaments, gland, lymph node, nerves, and vessels. The muscles is named as suprahyoid muscle, يعني طالع من الهايد بون وماشية فوق. The digastric muscle, which is boundaries of that region, يعني هي اللي تدير boundaries للsubmandibular region. Sometimes we call it digastric region. The mylohyoid muscle, which is formed the floor of the mouth. Geniohyoid muscles that attach to the mandible aid the lateral pterygoid in depression of the mandible, and the stylohyoid muscles, which is attached to the style process, aid in elevation of the hide bone during the swallowing. And we have two muscles which is attached to the tongue, or have an insertion in the tongue, which is the hyglossus muscle that is attached to the tongue, which is one of the big muscles of the tongue, and the genioglossus with the biggest muscle of the tongue. Okay, so the ligament is a ligament which is resembles to that muscle, which is called the stylohyoid ligament. The glands, we have the submandibular gland, salivary gland, and the sublingual salivary gland, which is separated by the mylohyoid line in the submandibular and sublingual fossae of the mandible. Addition to the glands, we have the lymph nodes, which are in this region is submandibular lymph node, and in the midline we named as submental lymph node. The nerves, we have two nerves. Those two nerves, كيف ما قلنا في المحاضرة, they are related to the hyglossus muscle. Okay, those are the lingual nerve and the hypoglossal nerve. وعندنا nerve بيجي مع المصل متاعه اللي هو اسمه glossopharyngeal nerve, cranial nerve number 9, and we have the ganglion, which is suspended from the lingual nerve to give the parasympathetic supply to those glands. And finally, we have the facial vessels and the lingual vessels, which are the branches, being the arteries, branches from the external carotid artery. So we are going to talk about these contents one by one. Let's start by the digastric muscle. This is the digastric muscle, and we have two belly. The first belly, which is called the anterior belly, is coming from the gastric fossa and the mandible here, and the posterior belly, which comes from the inner surface or the medial surface of the mastoid process, okay, from the inner surface. So those two muscles are being attached here by what's called an intermediate tendon, which is hooked up by a fibrous loop اللي هو هذا to be attached to the hide bone. So that is the posterior belly, and is going to pierce أو تخترق من stylohyoid muscle. That's so interesting to see a muscle piercing muscle. So the action of that muscle being attached like this way is going to rise the hide bone during the swallowing, And as an inverse action, when we fix the hyoid bone, this muscle is going to aid in depression of the mandible. Those are the action of the digastric muscle. Okay. Again, that's the posterior belly of the digastric, and that's the anterior belly of the digastric. This region we name it as the submandibular region, and we have talked that in details in the posterior triangle and the anterior triangle, how it's divided by those muscles into muscular, carotid, and so on. Those muscles are the anterior belly of the gastric, and that is the posterior belly of the gastric. So important muscle as a landmark. How this muscle is innervated. The muscle is supplied as being, as we said in the lecture, that's the رغم ان two bellies يعني خوات, ولكن الأوريجين embryological origin of those muscle different. هذه comes from what's called the first pharyngeal arch, and this comes from the second pharyngeal arch. وقلنا ان الارches they kind of like this. That's the embryo and the first 2 weeks. Okay, that's the head region, and that's the neck region, that's the tail. That's why we have the name the cranial end and the rostral end نهاية ديلية. Okay, and the region of the pharynx or the neck at this moment الneck مكونة من arches. Okay, those arches are named as the pharyngeal arch. كل arch is that's specific for the head and neck region. يعني الكلام هذا ما يصيرش إلا في الhead والneck region. That's the embryo. Okay, a little bit angry. Okay, those are the pharyngeal arch named as first one, second, third, fourth, and sixth. So one of them is going to be rudimentary, is going to be disappeared. المهم عندي إن كل pharyngeal arch has an artery make it by another color, has an artery, okay, has an vein, nerve, and has a skeletal component. So ثلاث حاجات. الارtery is going to supply all these structures that comes from that arch. Nerve is going to supply all the structures comes from that arch, and the skeletal is going to give muscles, bones, cartilage from that arch. Okay, so by this we have structures that are innervated by this nerve, and the structure of the second pharyngeal arch is going to be innervated by another nerve. Anterior belly is coming from the first one, so it's going to be innervated by the nerve of the first arch, which is the mandibular nerve. The second arch gives the posterior belly, and posterior belly comes from the second arch, so it's going to be innervated by the nerve of the second arch, which is the facial nerve. That's why we talk about this in Project Story to show how the two bellies have a different nerve supply. Okay, that's the anterior belly, how it's deeply ليها قاعدة الميلوهايد muscle, and as I said in the lecture, you have to remember this relation, and then the floor of the mouth is going to be done by the mylohyoid and to be continued by the genioglossus muscle اللي هي تخش تحته. Okay, so deeply digastric muscle we have the mylohyoid muscle briefly. شنو الحاجات اللي فوق منها؟ That's the digastric muscles. We have the gland, which is the submandibular gland. We have the vessels, which are the facial and the facial artery and the facial vein. A little bit of the masseter muscle is going to descend on that. يعني المصل ماشية بالشكل هذا. Is going to be covered by the portal gland and the masseter muscle for the posterior belly. Those are all these structures whose is line spiral red here is going to be considered as a superficial relations of the gastric muscle. Additionally, that's the anterior belly and that's the posterior belly of the gastric. That muscle is going to be deep to the mastoid process, so we consider as the mastoid process as a superficial relation. All these are superficial relation to the posterior belly of the gastric. Remember the part of the mandible, the parotid gland. Okay, all these structures going to be masseter, all these structures are going to be superficial to the posterior belly of the gastric. What about um, the deep relation of the posterior belly of the gastric? This one, we have the hypoglossal muscle, as we said. Okay, يعني المايلوهايد deep للanterior belly والhypoglossal is deep to the posterior belly. So remember those things. So what are the structures seen deep to the posterior belly of the gut, which is important? First of all, we have the big vessels, the internal jugular vein, and next the nerve which is passed posteriorly like this, which is the accessory nerve, and the carotid system, which is formed by the internal carotid and the external carotid arteries. Okay, and between them we have the vagus nerve. So all these structures are going to be deep to the posterior belly of the gastric, covered by the posterior belly of the gastric. So the big vessels plus the two nerves, carotid nerves, the 11 and the 12. And finally the vagus nerve in between. يعني عندنا that's the relation of the carotid system. في الكاروتيد triangle also we mentioned those three nerves. قلنا في nerve اللي هو الhypoglossal nerve is going to cross the vessels and pass anteriorly. The glossopharyngeal nerve is going to cross the vein and passing posteriorly. والعاشر ينزل in between. So that's the important relation of the posterior belly of the gastric. Again, هذا المنظر شايفين هذا الاكسسوري how they cross like this, hypoglossal crossing the arteries, vagus nerve is passing down, and those are the big vessels which is deep to the posterior belly of the gastric. Internal jugular, internal carotid, external carotid, spinal accessory, and the hypoglossal nerve. Okay, finally the vagus nerve. في حاجة تانية أخرى. Those two arteries which are branches of the external carotid artery, يعني هذا هو external carotid artery. That's the external carotid artery, and this one is the internal. The external carotid is going to give posteriorly two arteries, which is the occipital artery and the posterior auricular artery. طيب شنو علاقتهم بالposterior belly of the gastric? One of them just below and one of them above. حتى لما يعني في الكاديفر زمان كيف نعرفوهم؟ نعرفوا الارتري هذا والارتري هذا so close قريبين من بعضهم. نعرفوا الارتري اللي ماشي فوق البستيريور بلي هو البستيريور اوريكولار، والارتري اللي ماشي تحته هو the occipital artery. Okay, those are the structures اللي حكينا عليهم اللي هم الفيجاس والفيج فيزلز والهايبوجلوس. That's enough about the posterior belly of the gastric. Let's talk about the mylohyoid muscle. The mylohyoid muscle, as we said, we have no bony floor on the mouth, so we have the muscle that making the floor of our mouth. So the mylohyoid muscle is originating here from the inner surface of the mandible, from what's called the mylohyoid raphe. Mylohyoid line, the mylohyoid line. And to be inserted, the two muscles in the midline inserted in what's called the raphe. The raphe is nothing but a meeting of two identical muscles in the midline. So posteriorly is going to be attached to the hyoid bone. So the name is mylohyoid muscle. Okay, that's the line, that's the raphe, and that's the attachment to the body of the hyoid bone. The muscle is innervated by what's called the nerve to the mylohyoid muscle, which is the mylohyoid nerve. Remember that this nerve comes from the mandibular nerve قبل ما يخش في الcanal. Okay, the action of that muscle being attached by this way is going either to elevate the hyoid bone during swallowing, or is going to fix the as inverse action is going to fix the hyoid bone and help in a depression of the mandible. What are the important relation of the mylohyoid muscle? That's the genre اللي هي اليلو. هذه هي المايلوهايد muscle. I have it's be colored by the yellow. Okay, شنو الحاجات اللي فوق منها? As we said, the anterior belly of the gastric is one of the superficial structure, and the submandibular salivary gland and those two vessels اللي جايين من الفاشيال وماشيين anteriorly, which are the submental vessels, submental artery and submental vein. Remember that زي ما قلنا هذا that's the nerve to the mylohyoid بيكون شنو يطلع قبل ما يخش ال inferior alveolar to the canal ويكمل to reach the gland to reach the muscle of him اللي هو mylohyoid nerve, okay, or nerve to mylohyoid, that's one. Okay, the deep relation, that's the cross section, I mean the like a sagittal section to show the relation of the mylohyoid. That's the muscle, which is the mylohyoid muscle. There is a part of the submental gland which is as superficial as we said before, but the gland is going to turn below and get deep to the muscle. So part of the gland is going to be also deep, plus the sublingual salivary gland. يعني submandibular جزء منها superficial and another part deep, plus the sublingual. وزي ما قلنا as those two muscle الهايجلوسس بتكمل مكان المايلوهايد posteriorly, so ولكن مش على one line، بتكون شنو اللي a little bit deep ليها. هنشوفه في السلايد هذه. يعني that's the mylohyoid muscle بتكون من هنا، وبعدها بتجي مكانها من الهايجلوسس muscle. الهايجلوسس muscle بتكون deep ليها زي ما قلنا في الليفل، and بتكون related to two important nerves. That's the lingual nerve and that's the hypoglossal nerve. So remember this view, please. That's the lingual nerve, which is hooked or hangs the submandibular ganglion this way, okay? وقاعد عليها submandibular gland to give innervation by this ganglion. يعني المنظر هذا مهم. الهايجلوسس muscle, nerve above اللي هو lingual, nerve below hypoglossal، وجانجليون في النص اللي هي submandibular ganglion. Okay. Let's see next the geniohyoid muscle. The geniohyoid muscle is that small muscle that comes from the genial tubercles in the midline, what's called the inferior genial tubercles, since the superior one is going to give the genioglossus, the inferior one giving the geniohyoid. The muscle sweep back and below to be attached to the hyoid bone. Remember that this muscle is going to be supplied by the C1, okay? It's supplied by the C1 اللي هو ماشي مع الهايجلوسس nerve. يعني عندنا geniohyoid is going to be supplied by C1, a thyrohyoid is going to be supplied by C1, while other muscles, or especially the infrahyoid muscle, is going to be supplied by what's called the ansa cervicalis زي ما قلنا في المحاضرة. That's the genial tubercle, and that's the inferior genial tubercles. That's the hyoid bone. Okay, what about the action of that muscle? It's a small muscle, ولكن تساعد في elevation of the hyoid bone during the deglutition, or aid the lateral pterygoid and depression of the mandible. Okay, next is going to be the genioglossus muscle. The genioglossus اللي هي this one's big muscles, the biggest muscles, we'll say, is coming from the genial tubercles to be inserted into the lateral part or lateral side of the body of the tongue. Being muscle of the tongue, so is going to be supplied by the hypoglossal nerve. This muscle جاية من قدام وماشية للخلف، تسحب الtongue anteriorly, so we name it as protrusion of the tongue. The next muscle, which is the hyglossus اللي حكينا عليها وقلنا هي بتكون deeply الميلوهايد muscle، وقلنا بتكون deeply anterior belly of the gastric and so on. This muscle is going to be originated from the hyoid bone like this من البody والgreater corn. هذا البody وهذا greater corn completely to be attached to the side of the tongue زيها زي genioglossus. This muscle being a muscle of the tongue, so it's going to be supplied by the hypoglossal nerve, and that muscle being attached from below upward to the tongue, so it's going to be the tongue downward during movement, and was named as the depression of the tongue. Okay, that's muscle. Some of them comes from the stylet process. To see what are the structures seen attached to the stylet process. We name that as a styled apparatus. We have three muscles and two ligaments. The muscles are the styloglossus being كلهم بادين بستايلو styloglossus to the tongue, and the stylohyoid which is attached to the hyoid bone. Okay, remember that the muscle of the tongue should be supplied by the hypoglossal nerve, and that muscle is a stylohyoid is going to be supplied by the facial nerve قبل ما يخش الفيس. Another muscle which is called the stylopharyngeus muscle, stylopharyngeus to the pharynx, actually to the thyroid cartilage of the larynx, and the only muscle that's supplied by the glossopharyngeal nerve, or in other words, the glossopharyngeal nerve is supplied one muscle which is a stylopharyngeus muscle, and those two structures comes to the neck together يجوا مع بعضهم يعني المسل والنيرف سبلاي متاعها. احنا اوريدي عرفنا styloglossus. I mean one of them عرفنا اوريدي. تعالوا نشوفوا stylohyoid muscle. The stylohyoid muscle is a small muscle وعرفنا ان هي comes from the style process to be attached to the hyoid bone, والمسل هذه pierced by the posterior belly of the gastric. المسل هذه to be supplied by the facial nerve قبل ما يخش لي الفيس. وthose muscle يعني attached from upward to the hyoid bone, so ترفع الهايد bone during deglutition. That's the style process, and that's the hyoid bone. Remember the code color here, blue for the insertion, red for the origin. That muscle is called the styloglossa, a small muscle which is coming from the style process تمشي anteriorly to be attached to the back of the tongue, and يعني to be attached to the sides of the back of the tongue. Muscle of the tongue, so it's going to be supplied by the hypoglossal nerve and come from back to be inserted in front, so it's going to pull the tongue backward and a little bit upward as a level superior. The last muscle, which is the stylopharyngeus muscle, remember that the pharynx is going to be formed by two type of muscle cross يعني مدورة ونسميها constrictors. We have three, and three muscle longitudinal. One of them is اللي هي اليلو هذه اللي هي stylopharyngeus, coming from the style process to be inserted into the back of the thyroid cartilage, being muscle of the pharynx is going to be supplied by the glossopharyngeal nerve, and that muscle is going to, as the style process is fixed, so it's going to pull the cartilage, pull the pharynx completely during swallowing. What that muscle? What do you think? Style process to the tongue. So that is the styloglossus. Style process and styloglossus. And that muscle, what is? The hypoglossus muscle, genioglossus, and that muscle is going to be the stylohyoid muscle. Another small muscle here coming from the geniotubercle to the hyoid bone, geniohyoid muscle. Remember that this muscle is going to be supplied by the hypoglossal nerve. The stylohyoid is going to be supplied by the facial nerve, and the stylopharyngeus muscle is going to be supplied by glossopharyngeal nerve as attached to the posterior belly of the gastric. Okay. That's about the muscles. What about the ligaments here? We have the stylohyoid ligament, which is زي المسل طالع من style process to be attached to the hyoid bone, and we have what's called the stylomandibular ligament اللي هو طالع من style process لكن يمشي يدير attachment to the angle of the mandible، يعني يساعد في تثبيت ال TMJ أو temporomandibular joint. It's not too much useful because it's small. It depends on the fixation or the support of the temporomandibular joint on what's called the lateral temporomandibular ligament اللي هو the strongest one. Okay, let's move to the gland, which is the submandibular salivary gland. We talk about this gland. It lies in the digastric fossa in the digastric triangle. So it's wedged between المصل اللي جوا اللي هي الميلوهايد وبرا the body of the mandible. This muscle, this gland, being a gland in this region, as the other gland, like other gland, is going to be investing by the investing layer of the deep fascia. So the name is deep investing layer because it's going to invest all the large gland in this region. That's the submandibular gland, okay, and that's the triangle, and that's the mandible, and that's the mylohyoid muscle, okay. So this gland is going to have two parts. The part which is out, we name it as lateral or large superficial part, and the one which is deep, we name it as the small deeper part. That's in relation to the mylohyoid muscle, superficially and deep, okay. يعني بس هم طبعا ما همش منفصلين being one as one piece, so it's going to be continuous on the lateral border of the mylohyoid muscle or lateral border. Okay, that is the two part, deep and the superficial. Again, that's the gland, how it's going to be continuous on the posterior part of the mylohyoid muscle as superficial, deep and superficial, okay. That's the two parts. If we talk about a little bit about the superficial relation of the submandibular gland, we have these two structures. يعني عندنا superficial part that's a little bit important because we have a lot of problem caused by those glands. What's we name as cellulite اللي هم وجود حصى، لأن الجلاند بتاعها a little bit tortuous وطويلة، فدائما نحصل فيها يصير فيها stone in the duct, so sometimes have problem pathology in the gland. We have to remove this gland, so we have to see what are the vital or the important structures related to that gland. Superficially, we have the skin, then comes the superficial fascia, including the platysma that's covering all these regions. Then comes the deep fascia here, the investing layer. Then comes all those structures. We have the facial artery الأحمر هذا and the facial vein, okay, and we have a little bit of lymph node here, and remember that in في nerve حينزل من فوق هنا البلاتيزما exactly here, which is named as the cervical branch of the facial nerve to supply the platysma, okay. Those are the facial vein, lymph node and facial artery. What about laterally؟ يعني شن في هنا، هي موجودة هنا وبالتالي laterally ليها حيكون mandible. المانديبل يعني لوطة كان superficial وهنا نقوله lateral، يعني عندنا three relation. اللوطة هنا superficial لأن على الشارع زي ما نقوله، يعني على skin، وهنا no هنا is covered or protected by the submandibular fossa of the mandible. يخش من بيناتهم الفيشل artery، اوكي. طيب medially، طيب يعني medially من جوا هي related الجلاند قاعدة هنا، وبالتالي حتكون related ل 3 parts. Firstly بتكون related to the mylohyoid muscle, then related to the hypoglossal muscle, then related to the superior constrictor or the part of the pharyngeal wall. Okay, so we have 3 parts in relation to the medial surface of the gland. يعني الجلاند قاعدة جوا من جواها عليه شنو. Okay, those are the mylohyoid, the hyglossals, and then the pharynx or superior constrictors. Okay, those are the okay. الجلاند فوق منها بيمشي nerve وتحت منها بيمشي nerve. Though the nerve which is passed superiorly is the lingual nerve, and the nerve which passing يعني just above the hyoid bone is the hypoglossal nerve. Okay, remember that one nerve above, one nerve below the gland. That's the gland. Okay, that's the yes, that's the lingual nerve, and that's the hypoglossal nerve. Okay. Again, a little bit larger here to see the lingual nerve above the gland, the deep part of the gland, والhypoglossal nerve هنا. طبعا lateral زي ما قلنا حكينا هنا اللي هم 3 muscles اللي حكينا عليهم. Okay. Okay. What about the gland duct? We named it as Wharton duct. طوله حوالي كيف ما قلنا 5 سنتيمتر. comes from مش من large deeper، لا بتجي منين؟ من small مش من large superficial، بتجي من small deeper part of the gland. الجلاند هذه حتقدر intervenes تدخل ما بين زيها زي الهايبوجلوسال نيرف، هذا تدخل ما بين المايلوهايد muscle والهايجلوسس مصل. اوكي those two muscles. وبعدها تمشي بالشكل هذا، تمشي لعند ما توصل وين؟ توصل الى حاجه اسمها sublingual papilla. اوكي طيب، وهي ماشيه بيجيها lingual nerve، في الاول بيكون lateral ليها، بيكون below ليها، وبعدين يمشي للتنج media ليها. so you have a triple relation ما بين الduct وما بين lingual nerve، laterally, below, then medial. remember this. okay what's that? On genioglossus duct, what on genioglossus the ducts open into the floor of the mouth. حتمشي طبعا هنا حتكون على genioglossus على this muscle. اوكي شنو حتفتح في حاجه اسمها sublingual papilla. شنو هي sublingual papilla؟ عباره عن شنو elevation، حنشوف في next صوره next. يس هذا التربل ريليشن اللي حكينا عليه بين الداكت وبين اللينجوال نيرف. حتجي وين تفتح كيف ما قلنا هنا، هذه اللينجوال فرانيولم وهذا السبلينجوال بابيلي. اوكي تفتح دايركتلي او جاست ميديال نيكست تو ذا فرانيولم. هنا مش هذينا كل هذينا بتاعت السبلينجوال داكت، لكن هي عندها one duct او one orifice which is named as submandibular salivary gland duct، تفتح next on both sides of lingual frenulum. الارتفاع هذا نسميه sublingual papilla. The muscle is going to be supplied by the next nearby vessels, so it's going to be supplied by the facial artery and lingual and common facial vein to be drained into the submandibular lymph node، الحاجات اللي هن قريبات منها في الريليشن. okay that's the facial artery، السمول هذا زي ما انتم شايفينه very close يمشي قدامها ويخش بيناتها وبين من وبين الماندبل. that's the common facial vein and lingual vein, those two veins and the lymph node which is above. طيب بالنسبة ل nerve supply of the gland، طبعا being a gland so it have as usually three type of nerve supply: sensory to get the pain from the lingual nerve, sympathetic from the sympathetic plexus around the facial artery. دائما نبحث على أكبر vessels موجود وتكون sympathetic plexus around it. The parasympathetic comes from chorda tympani. This nerve is coming from the facial artery joining the lingual nerve، ينزل معاه لعند لوطة باش يعطينا supply. So the supply is going to be by chorda tympani through lingual nerve. To see that يبدأ هذا brainstem، هذا bones where the facial nerve come, and from the facial nerve comes the chorda tympani, very short nerve في زي ما خذيناه من قبل في منطقة الانفراtemporal fossa is going to join وليس يقعد من يعني من nerve fiber متاعه، يمشي معه فقط. lingual nerve يمشي لعند لما يوصل وين؟ يوصل السبمنديبولار ganglion and next السبمنديبولار ganglion حتوزع البوست ganglionic parasympathetic supply to the sublingual and submandibular gland together. Okay, that's the innervation of the submandibular gland. Okay, what's next? Is the sublingual salivary gland. The sublingual salivary gland is the smallest gland يعني بعد الباروتيد والsubmandibular gland وهي موجودة هنا. okay we're not going to talk about in detail about the relation، بس على الأقل نعرف إن هي is going to be covered من فوق بالميوكس membrane ومن تحت بالمايلوهايد muscle يعني من هنا. okay قاعدة في السبمنديبولار في السبلينجوال fossa في المانديبل. okay ميديال ليها هنا بيكون الدكت بتخطم عليها زي ما احنا شايفين، هذا الدكت بتاع السبمنديبولار جلاند بتكون ميديال ليها. اوكي وهي تفصلها على المصل اللي هي هذه اللي هي اسمها جينيو جلوسس مصل، اللي هي طالعه من جينيو جلوسس من جينيو هايد وماشيه للتانج. so that's the relation. so again the sublingual salivary gland is going to be related laterally to the mandible, above mucous membrane, below the mylohyoid, and medially كيف ما قلنا مفصولة على الجينوغلوسس بالدكت متاع من؟ متاع السبمنتبلر جلاند. هذا الصورة أكبر شوية. أوكي، كيف تفتح هي؟ هنا تفتح دايركتلي ب20 حوالي 20 15 كي داكتس في نفس المكان هذا اللي حكينا عليه من بدري. الفتحات هذينا يصلن إلى 20 وممكن أقل شيء 8 سب لينجوال فولز. بالنسبة للبلد سبلاي the same، يعني is going to be supplied by هذيك كانت بالفيشل ارتري، هذه لينجوال سو تكون باللينجوال ارتري. هذيك كانت بالكومن فيشل فين مينلي واللينجوال فين، هذه باللينجوال فين. الليمف نود the same والنيرف سبلاي is going to be the same. كيف الجانجليون حكينا عليه هنا، اللي هو قلنا هذه submandibular ganglion اللي هي hooked أو suspended from the lingual nerve على الهاي glossus muscle، وكانت تاخذ في nerve supply sensory من lingual nerve، sympathetic من ال sympathetic process around the facial artery اللي هو مخطم عليها هيك، وباراسمباثيك من الكوردا تمباناي. all these fibers يجمعن ويدير رجلي في السبمندبلر ganglion اللي حتعطي directly the salivary gland. هيك نكونوا كمان submandibular region. and next time إن شاء الله حنشوفوا another topic. thank you.